Hello and welcome back to Money Never Sleeps. My name is Bob Cruces from M&A Wealth. If you'd like more information about what you hear during the show, give us a call at 866-973-3627 or visit us online at mnawealth.com. And while at my website, click on the page to check out past shows and subscribe on Apple Podcasts or Spotify. When people think about retirement planning, their minds usually go straight to savings, investments, and income. But for many retirees and people approaching retirement, some of the biggest surprises don't come from the markets, they come from healthcare. Healthcare decisions often build quietly over time. They may not feel urgent at first, but they can have a meaningful impact on both finances and quality of life as retirement unfolds. That's why I wanted to spend some time on this topic today. For today's conversation, I'll be sharing insights and statistics from a recent Forbes article called 5 Mistakes Retirees Might Make Regarding Healthcare. The article highlights common missteps retirees and near retirees can make, not because they aren't thoughtful planners, but because healthcare is one of the more complex and misunderstood parts of retirement. One of the reasons this topic comes up so often in conversations with retirees and people approaching retirement is simple: healthcare costs create a lot of uncertainty. If you're worried about what healthcare might cost you in retirement, you're definitely not alone. According to a survey referenced in the Forbes article, nearly 2 out of 3 boomer respondents said that expensive healthcare costs are one of their top retirement fears. More than 2/3 of respondents worried that a single large healthcare issue could disrupt their finances for years. That tells us something important. This isn't a fringe concern, and it's not just about everyday expenses. For many people, the fear is that one unexpected healthcare event could throw everything off balance. Now, one of the key points the article makes, and one I strongly agree with, is that worry by itself isn't a strategy. Feeling concerned is understandable, but it doesn't actually move you closer to clarity or confidence. What does help is understanding where people tend to get tripped up and how better information can lead to better choices. That's why this article focuses on 5 common mistakes pre-retirees and retirees make when it comes to healthcare, and just as importantly, how those mistakes can be corrected. This isn't about predicting the future or trying to eliminate every risk. It's about being informed, asking better questions, and making thoughtful decisions instead of letting fear drive the process. The first mistake the article points to is not budgeting for increased healthcare costs in retirement. This one catches people off guard more often than they expect. Many new retirees are surprised to learn that their healthcare premiums and out-of-pocket expenses can be significantly higher than what they paid while they were working. When you're covered under an employer-sponsored plan, it's easy to underestimate just how much of the cost your employer was absorbing on your behalf. According to the survey referenced in the article, 40% of retirees don't actually know how much they expect to pay for healthcare in retirement. That uncertainty alone can make planning much harder than it needs to be. This issue can be even more pronounced for people who want to retire before they're eligible for Medicare at age 65. For those individuals, healthcare coverage often means purchasing insurance on their own, and the article notes that monthly premiums can easily exceed $1,000 per person. When you put that into context, it becomes clear why this mistake matters so much. If those premiums aren't accounted for ahead of time, they can put real pressure on a retirement budget and in some cases, even affect the timing of retirement itself. That's why the article emphasizes the importance of understanding whether these healthcare costs will realistically fit into your retirement budget before you decide to retire. When healthcare costs are acknowledged up front, they become something you can plan around. When they're ignored or underestimated, they tend to show up as an unpleasant surprise. The second mistake the article highlights is assuming Medicare works just like the employer-sponsored healthcare coverage you had while working. In practice, Medicare is very different. It's made up of multiple parts, and each of those parts has its own deductibles and co-payments. In many cases, those out-of-pocket costs are higher than what people were used to paying under an employer-sponsored plan. That's why the article stresses the importance of planning ahead. It's not enough to know that Medicare exists, you also need to understand how deductibles and co-payments might show up in your budget after you retire. Taking the time to estimate these potential out-of-pocket expenses allows you to see whether they realistically fit within your retirement income plan. Medicare can be a valuable benefit, but it's not cost-free. When people plan for it thoughtfully, it becomes part of a more complete and realistic retirement picture rather than an unpleasant surprise later on. Another common misunderstanding the article addresses is assuming Medicare covers all healthcare-related expenses. In reality, there are several important areas it doesn't cover at all. Medicare doesn't pay for most vision, hearing, or dental expenses. That includes things like eyeglasses, hearing aids, and dental procedures, and those costs can add up quickly. These aren't rare or unusual needs, they're common as people age, which is why the article emphasizes thinking ahead. If you expect to have expenses in these areas, it's important to understand their potential costs and determine whether they'll fit into your retirement budget or possibly an emergency fund. The article also highlights another major gap that often surprises people. Medicare does not cover long-term care expenses, and according to the survey referenced, only about 1/3 of respondents were aware of that. Overlooking these uncovered expenses can create strain later on, especially if they haven't been factored into the plan ahead of time. Awareness doesn't eliminate the costs, but it does give people the opportunity to prepare for them more thoughtfully. The fourth mistake the article highlights focuses on lifestyle decisions. About half of survey respondents aged 65 and older said they would advise their younger selves to maintain a healthy diet and take better care of their health to help manage healthcare costs in retirement. And this takeaway applies no matter your age. Improving things like diet, exercise, and sleep habits can certainly benefit your health and may even help reduce some healthcare expenses over time. However, the article is careful not to oversell this idea. Healthy habits are valuable, but there's no guarantee they'll prevent every expensive medical condition. That's why the emphasis is on balance, making positive lifestyle choices while still planning ahead for healthcare coverage that fits your budget and being prepared for out-of-pocket expenses. Healthy habits can be part of the picture, but they shouldn't replace thoughtful planning. Both matter. The final mistake the article discusses is not seeking professional help. According to the survey, retirees who work with a financial services professional are far more likely to have a plan for healthcare costs in retirement. In fact, respondents who worked with a professional were more than twice as likely to have a plan to pay for healthcare costs and more than twice as likely to have estimated what those costs might actually be. And yet, only about 1/3 of respondents reported working with a financial services professional at all. So, the article also makes an important point here. Working with a professional isn't automatically enough. Not all professionals help their clients plan specifically for healthcare costs in retirement. That makes it important to ask direct questions and ensure healthcare planning is part of the broader retirement conversation. The article wraps up by acknowledging that addressing all 5 of these mistakes can feel like a lot of work, but ignoring them can lead to very real consequences. Survey respondents said that high medical expenses in retirement could force them to cut back on travel and other non-essential spending, take on a part-time job, or even cut back on healthcare itself. Planning ahead for healthcare costs isn't about perfection. It's about giving yourself more choices, more stability, and a better chance to maintain both your financial well-being and your quality of life throughout retirement. If you have any questions about your retirement magic number, your retirement strategy, or any other parts of your financial strategy, visit my website at mnawealth.com or call my office at 866-973-3627 to discuss how my team might be able to answer your questions and address your concerns.
Disclosure. All matters discussed during the show are for informational purposes only. Opinions expressed are solely those of M&A Wealth and staff. All topics covered are believed to be from reliable sources. However, M&A Wealth makes no representations as to its accuracy or completeness. This commercial shall in no way be construed as a solicitation to sell securities or advisory services to residents where permitted. Topics should be discussed with your individual advisor prior to implementation. Advisory services offered through M&A Wealth, a registered investment advisor in the state of Texas. Insurance products and services are offered through PNC Life Insurance Agency, an affiliated company. M&A Wealth and PNC Life Insurance Agency are not affiliated with or endorsed by the Social Security Administration or any government agency.